Hi everyone, I'm Dr. Barrett, and this video is intended for my patients exclusively. If you've had surgery by another surgeon, please make sure to follow up with that surgeon for particular details about your surgery. And if you're having a medical emergency, please dial 911 or go to the nearest emergency room. Congratulations on your mommy makeover procedure. Remember, use the instructions in this video based on the procedure that you had. So if you didn't have a BBL, don't follow the BBL instruction guidelines, all right? If you just had your breasts and your tummy done, just follow those instructions and go through this video just like that. First and foremost, you're gonna have a little bit of stretching sensation. Now remember, we injected a lot of numbing medicines. You're not gonna have a whole lot of pain in your chest. It might feel a little uncomfortable, but that's gonna get better as the night goes on, and it'll be better by tomorrow. You can take Tylenol or CBD for pain. I recommend you don't take the Norcos. The Norcos are bad. They cause nausea, constipation, and they generally make you heal less fast, okay? So I'd rather you not take the Norcos, even though I prescribe them. They're there as a backup. When it comes to pain control, the CBD is the best option for this. You take a full dropper full, put it underneath your tongue, let it sit for a few minutes before you swallow it, okay? It's gonna absorb better that way, and take another full dropper full at nighttime when you're about to go to bed. I did not put you in a surgical bra on purpose. If I did, you're wearing one. If you're not wearing one, that's on purpose, okay? Majority of my breast augmentation patients, I do not put you in a surgical bra because I want the blood supply to reach the breasts. A t-shirt or loose-fitting sports bra is the best option for your healing. Now you gotta remember that little patch behind your ear. Take that off as soon as you get home, but don't rub your fingers on your eye after you do so. If you leave it on, you will get blurry vision. Not a big deal, just take it off when you're ready. You also have a medication called Zofran. If you're nauseous, you put that little medication underneath your tongue, it will help your nausea right away. I want you to take the antibiotics as soon as you get home. The Caflex, you take one pill 4 times a day, spaced out every 6 hours. Don't wake up in the middle of the night to take it, all right? Take one before you go to bed and one when you wake up until the bottle is empty. Now, if it's clindamycin, it's one pill 3 times a day until the bottle is empty. Remember, all the antibiotics need to be taken their full course. The only time I run into infections is when people don't take the full course of the antibiotics as prescribed, so make sure you do that. Next thing is the Colace. Take one pill twice a day until you have a bowel movement. Once you're done with that, you no longer need to take the Colace. All these medications can be taken on an empty stomach, so take them right away. With your implants, you should have gotten one of these little cards. It's got all of your implant information on it right here. And if you didn't get it, call us right away. Take a picture of it with your phone. Save that image forever, all right? That is very important information, and it's important for you to register for your warranty, which you should do right now, okay? mentordirect.com/warranty. Fill out your information. The serial numbers we provided on this card so that you can get coverage of your implants through Mentor Direct in case you have any problems with rupture or capsular contracture, okay? We don't make any money off of it. It's just there for you to cover financial assistance in case you do get capsular contracture, and it is worth every penny. One device in particular will help with a lot of your swelling and bruising. It's called red light or light stim therapy. If you have a red light machine, use it right after surgery. You can put it right on the incision or right on your body. We also sell a handheld version of the light stim in our office. Ask questions about that at your next visit. You can also take a shower 24 hours after your operation. You can get everything wet. I do not want you to take a bath, hot tub, swimming, or getting in a body of water like the ocean or a jacuzzi. That just basically invites bacteria in. The pressure of the water can cause an infection. Shower is okay. Standing water is not okay. Overall, you want to be very healthy after your operation. Meditation to help lower your stress, okay? Smokers, you can't smoke for at least 6 weeks. For alcohol, people that like to drink wine or drink beer, there's no alcohol consumption for the next 2 weeks. That's going to decrease your ability to respond to any infections. How should you sleep tonight? You should sleep slightly elevated for the first 3 nights. That's it, folks. Have a few extra pillows, sleep with your back upright. That's gonna help some of the initial swelling go down. After that, you can start to lay flat, and then after 7 days, you can start to lay on your side as you feel comfortable. I wouldn't sleep on your stomach until about 6 weeks to avoid pressure on your breasts. If you are concerned about stretch marks, you can take a little bit of cocoa butter and vitamin E and place it far away from your incisions on your breasts, okay? Do not put them on your incisions. That's our territory to help you with the first few weeks. We're gonna keep that taped, all right? We're gonna tape it once a week for the first 6 weeks. We're gonna take out the first layer of stitches at your first post-op visit, and we're gonna take out the second layer at your second post-op visit. Here's your exercise regimen. It's really easy. First 2 weeks, I just want you walking around. You don't wanna raise your heart rate up, okay? That includes sex and any activity that's gonna stimulate you to raise your heart rate up. That's gonna cause bleeding, all right? Be very careful. No heavy lifting, anything over 8 pounds, all right? Be careful opening doors, pumping gas in your car, or anything that might require some additional exertion. Use 2 hands if you have to. Picking up children, I don't recommend it, but if you absolutely have to, wrap your arms around them and lift with your legs, okay, not with your arms. After the first 2 weeks, then you can actually start to do some exercise. That's like walking upstairs or doing walking incline workouts or isolated leg workouts. We don't want to do any upper body. At week 4, we can start to do jogging with a supportive bra. At week 6, you can actually start to do upper body workouts. Get excited, but use your body as a guide. If something hurts, take a day or 2 off before you get back at it. Now, it's normal to have some pain, some burning sensation, some little electrical tingles, zingers, everything that you could possibly think of might be happening in your breast. Guess what? Good news is it all goes away right around 6 weeks, okay, when that starts to settle down and when we start to do massage. That's your nerves waking back up from the trauma of the surgery, all right? We try to minimize that as much as possible, but your nipples might be numb during that time. They might be hypersensitive, but don't worry, that sensation starts to normalize as your healing progresses. Sometimes it may take up to 6 months for that sensation to either come back or get back down to normal. Don't worry, most situations it does get back to normal. If you had a breast lift without an implant, your recovery is going to be much faster than if you did have an implant. The main reason why is because we didn't have to put an implant underneath your muscle. So most of your activity can resume at 2 weeks, as opposed to if you did have an implant, you can't do any heavy lifting or upper body workouts until 6 weeks. Your incisions are going to need to be taped for at least 6 weeks, and then you can start to do the scar gel afterwards. One thing to be aware of after breast lift surgery is nipple necrosis. If your nipples are appearing dark, one is darker than the other, or one is colder than the other, several hours after the operation, it's not getting better, give us a call, okay? We might need to have you put a warm compress on that one side versus the other side to kind of reestablish the blood flow. But that's something we want to be aware of right away. I want to talk briefly about steri strips. These are covering your incisions. If they fall off, no big deal. You want to replace it with a Band-Aid, all right? Now, sometimes your body swells with the steri strip on it. And if that happens, it can form a blister, all right? And if that blister happens, that's okay. Leave it alone. You can put antibiotic ointment on it twice a day, and we will remove the steri strip in the office. If you get an allergy, it develops a severe rash that's red and insanely itchy, okay? It happens on all the areas where you see this steri strip. If that happens, remove all your steri strips, wash with gentle soap and water, and take Benadryl and Claritin to help ease the symptoms. If you have any questions, give the office a call. We close your incisions in multiple layers. The deeper layers are using absorbable sutures to hold your wound together. Sometimes your body extrudes those and spits them out in a slight inflammatory reaction. And if that happens, it's not a big deal. It happens to about 20% of our patients. If you do see that happening, give us a call. We can take it out in the office, or if you feel comfortable, you can pull it gently with a pair of tweezers and trim it with beauty scissors so that it dives down below the skin incision, and then cover with antibiotic ointment for a few days or steri strip. It's normal to have swelling. It's normal to have bruising. It's also normal to have a little bit of anxiety and depression after surgery. That's a normal feeling, okay? By walking 3 times a day and getting a little bit of sunlight or red light therapy, that will actually boost your mood. So make sure to do that if you're feeling that way. This is one of the biggest operations that we do, okay? So there's a lot of things that you want to pay attention to. The very important things that I stress for all my patients are to walk around, stay mobile. The biggest thing that can happen to you that I can't fix is blood clots, all right? These can happen in your leg and they can travel to your lungs and they can kill you, all right? So take this very seriously. The same day of your surgery, get up, walk around. I don't care if you're hunched over. I don't care if it's just a 3-foot circle. Get up and do that at least once before you go to bed tonight, and then 3 times every day. Don't walk more than a mile, but getting movement back into your body helps prevent blood clots from forming. In addition, there should be compression stockings on your legs. Ideally, you can keep those on for about 3 days. Those actually help prevent blood clots in your legs from forming from the time of surgery and can be safely removed after 3 days. The second most important thing I tell all my patients is make sure you stay hydrated, all right? Sometimes you get nauseous after a surgery like this, and we do a lot of liposuction, typically with a tummy tuck or without it. Either way, your body can third space and you lose a lot of fluid in your body. You don't even know you're dehydrated until it's too late. Then you get nauseous and then you can't eat or drink anything. So stay ahead of that. Gatorade, Pedialyte, water, all right? Soups, all that stuff is great to keeping you hydrated the first 24 hours. You want to make sure that you start peeing. If you start peeing, then you know that you have enough fluid on board. After a tummy tuck, it's normal to have some pain, okay? The first 3 days are the worst, and we recommend all of our patients to get Exparel. It's a long-acting pain medication that we inject along your plication if you do get a plication and your incision. Either way, you still might have some pain the first 3 days, and if you do, there is Norco, which is a prescribed pain medication that you can start taking, although I recommend you try to take Tylenol and CBD first to help with that pain, and then if you need to, use the Norco as a last resort. You will have some swelling, and that's okay. That swelling might extend upwards or downwards as gravity takes its toll. You might even be hunched over for the first few days. I want you to stand up straight over 5 days. Do know that it's normal to have swelling above your incision for up to a year, and on the corners of your incision up to a year. There might be some extra skin there. The swelling on the top part of the abdomen slowly starts to resolve as the lymphatic channels start to regrow beyond the incision. I recommend to take CBD during your postoperative period. It's normal, especially after such a big operation like this, to go from here down to here. Right about 2 weeks, you start to feel anxious and depressed. And then right around 2 weeks, you'll start to turn that corner and start going back up to normalcy. So if you feel down on the dumps, if you feel like crying, get some support, but know it's just temporary and we're gonna get you through it. Everybody, I'm Dr. Barrett. I'm going to talk to you about drain removal and drain care, okay? This is our patient here. She is 1 week out from surgery. She had a tummy tuck procedure. We put in 2 drains. I feel that drains are necessary because it helps drain off some of that bad fluid that builds up otherwise, okay? So when you go home with your drains, you want to make sure that you keep track of your drainage output, okay? So you can see that there's one side here is her left side, and then that's her right side there. So her left side is actually lowering down enough, which is what I'll check. So make sure you keep your drain log and bring it to your doctor. And I'll check and make sure that the amount is appropriate for a removal. When you go home the day of your surgery, you want to make sure that your drain is on suction, okay? And then it's building up fluid, okay? So if it's not on suction, this is a way to relieve it, this little white cap. You want to squeeze it, it's kind of like a little grenade. Squeeze it like that, and put this back on so that now it maintains suction. So you want to make sure that you empty it at least twice a day. And if it fills up, you know, make sure you empty it and put it back on suction. Now, one of the things you want to do at least once a day, take what I like to do is a little antibiotic ointment, and you kind of helps you slide your fingers along the tube. So take the pressure off of that and then slide here. You see how that just brought extra fluid in there? And in case there's any extra blood clots in there, that helps get that out. So make sure you record your drain output and you drain this fluid out like this. Okay, that's called milking the drain. Now, the next step we're gonna do is actually remove the drain, which is a painless procedure, okay? The older drains used to be painful. They were square, and you pull them out a round hole. It makes sense, that's gonna hurt. Now the new drains are round, they're like a noodle, so the noodle just comes right out, okay? So we're gonna do that right now. I'm removing this stitch. And that's the hardest part, okay? We're going to release the drain from suction like this by venting it, okay? What the venting does is it takes it off suction, so we're able to kind of gently pull it. All right, take a big deep breath, and then here we go, nice big pull, and it's out, okay? So a little bit of stuff that comes out with it. Was that painful?
Not at all.
There you go, folks. Drain removal is a very simple, easy, painless procedure, okay? And it's nothing to be worried about. It serves a necessary function of draining off the fluid. Now, she has 1 drain left. We're gonna take that out most likely next week, but we're gonna follow her drain output. We wanna make sure that she records her drain output appropriately so that we know when we can remove it. Generally, I like to wait until it's at least 20 cc's or less per day for 2 days in a row. If it's not, then we have to push it back to her next visit. Now, if you have a little bit of leaking around your drain outside your body, just reinforce with gauze and come show it to me at your next appointment. Not a big deal, okay? If you really pull on your drain and it pulls all the way out, not a big deal as well. Just give us a call, let us know, cover it with gauze, it'll be okay. If it partially comes out, leave it in place. Reinforce it with tape. A partially inserted drain is better than no drain. And remember, if you have no drains and the fluid builds up, we have to stick a needle in to drain off serous fluid every 3 days. This is an abdominal binder, okay? This is gonna go around your waist, and it's important not to put it on too tight. We don't give this to you right away after surgery. We give it to you 2 weeks after surgery, and it just needs to be snug. If it's too tight, you're going to cause little creases along the binder ridges that might leave a permanent mark on your body. Some people can develop an allergy to the binder because it has elastic fibers in it. If that happens, it develops as a diffuse rash in the area of the binder garment. If that happens, make sure you discontinue the binder and wash with soap and water. You only need to wear your binder for about 2 weeks. So what you can do beyond that is to wear Spanx or compressive garments that can help from the legs up. Okay, Spanx is our choice. It is compressive, but it's not too tight and it's very soft. After your tummy tuck, I want you walking right away. First 2 weeks, just walking. Don't want to raise your heart rate up. Be careful going up steps. You don't want to get that heart rate elevated. If you are going up steps, just take your time. Okay, you can get some bleeding if your heart rate goes up. At 2 weeks, you can actually start to do exercises. I would just do isolated extremity exercises or isolated leg exercises. Going up steps for a workout or walking incline to get your heart rate gently up is a good idea. Nothing more than that. At week 4, you can do a little gentle jogging, a little more rigorous activity. And at week 6, you can actually do core and upper body lifting and weights. But you want to use your body as a guide. Remember, we did a lot of abdominal work. Gentle is the way to start out. And if something hurts, take a few days off. So you want to be careful when lifting children. Use your arms, wrap around them, and use your legs to lift up. Sexual intercourse can resume after 2 weeks. I want you to sleep upright in bed for the first 3 nights, and then I want you to slowly start coming back down flat. If you sleep upright more than the first 3 nights, then you're going to start to have lower back pain that's going to drive you insane. It's important to use antibiotic ointment on your belly button twice a day after surgery. I recommend not to use Neosporin because it has neomycin, and that can develop an allergy to the belly button area, and that shows up as little red dots. If you do see that, make sure you use bacitracin or double antibiotic ointment or polysporin. It's important the first 24 hours to make sure you have somebody with you. You can easily get lightheaded after a tummy tuck procedure, and as you walk to the bathroom, you can fall over and hit your head, and then you have a head injury, okay? That's why someone needs to be with you and escort you to and from the bathroom and walking around the first 24 hours. I'm a big proponent of scar management, all right? You wanna use the Scanuva twice a day on your belly button after 2 weeks, okay? 2 weeks you're gonna do the antibiotic ointment, and then after that, if it looks clean enough, we can start to do the scar gel on your belly button. In addition to that, we're gonna be taping your incision for 6 weeks. We can't tape the belly button, so one of the things that we do recommend sometimes is this little belly button sphere. It's a silicone sphere. You want to put it in the belly button and tape it there for 24 hours a day. That's going to help create a more natural belly button. So be sure to ask for this at your week 2 appointment if it's needed. Some people don't need it, but many people benefit from this sphere. And I can tell you at the time if this belly button sphere is going to be right for you. So right around 2 weeks, you can start to undergo adjuvant therapies such as Venus Legacy skin tightening treatment, which has pulsed electromagnetic fields. Make sure you ask about that. It's a series of 8 treatments. It feels wonderful, speeds up your healing, and optimizes your liposuction result as part of your tummy tuck. In addition to that, we also recommend lymphatic massage that can start at 2 weeks if you feel up to it. A lot of our patients swear by it, and it helps their swelling improve immediately. If you feel in the areas of the liposuction on the flanks, they might feel areas of knots and firmness. You want to massage those twice a day in circular motions. I tell people if you take a shower, hop in the shower, massage 3 times in the area just to let it settle in, and that will help those little knots from the liposuction resolve faster. If you're getting a major body procedure like a tummy tuck or body lift or multiple site procedure, we recommend that you get one of our post-op recovery kits. It has everything you can possibly imagine you'll need after surgery, including gauze, medical supplies in here, saline, hand sanitizer, sleep mask, earplugs, you name it. It is personally picked out by me so that you have everything you need to heal and recover and take care of your body after surgery. One of the most important things to do after your procedure the same day is drink lots of fluids, Gatorade, water, soups, whatever it may be. If you get dehydrated after your procedure, which is very common, you might need IV fluids and have to get hospitalized. So make sure you start right away, stay ahead of it, and know when you're peeing on a regular basis that is a good sign that you have enough fluids on board. It's important after your Brazilian butt lift to not sit on your buttocks for at least 2 weeks. Okay, you can also do this for longer than that, but the evidence hasn't really shown any benefit of avoiding pressure on your buttocks for after 2 weeks. Now, why that's important is those little fat cells, they have to develop blood supply. Okay, so we want to minimize the compression on that so those little blood vessels can start to develop and feed those brand new fat cells. So if you're in a situation where you have to sit on your butt, make sure that you alternate and you move and you move and you move, okay? When you sleep, try to sleep either on your stomach or supported with a pillow underneath your thighs and your back so that there's no pressure on your buttocks. You can also sleep on your side if we didn't do any hip dip transfer, but if we did do some hip dip transfer, that might be a little more difficult. We also should have provided you with a BBL pillow to sit on at a desk. If you have to take a long airplane ride, make sure you get an aisle seat and get up very frequently to alleviate the pressure on your buttocks. It's actually very normal to have swelling extending down to the genital area if you had any liposuction on the upper body. This is normal for men to have scrotal swelling and normal for females to have significant bruising and vulvar swelling as well. You might also get bruising and swelling extending down into the legs, away from the actual liposuction sites. This is also very normal. The swelling can last easily up to 3 months to 6 months in certain areas. Don't expect your liposuction results to look good right away. For at least 2 weeks, it's going to actually look worse before it looks better. It's normal to feel slightly anxious or depressed the first week or two after your operation. Don't worry, this is a normal reaction to any surgery and gets better with time and support. You're going to experience a lot of drainage from your access sites. That is normal. Make sure you don't sleep on any fancy sheets tonight and put protective towels down before you go to bed so you don't ruin the bedding that you might have. It's normal for this fluid to look either clear or slightly bloody or even a tiny bit of blood. It generally subsides within 24 hours. Now for the buttocks, they're going to be bigger and different looking than what your final result's going to be. Remember, we have to overgraft the fat, so we expect to lose anywhere from 20 to 50% of that fat, so don't expect to see your final result in the mirror today. It can take up to 3 months for that fat to subside and you to get your final result. If you've had neck liposuction, try to keep your garment on for at least 3 days and then you can wear it at nighttime for the remainder of the week. It's important to control that swelling, but if it's absolutely uncomfortable, it's not entirely necessary. You'll have 2 little incisions under here that might leak a little bit of fluid. Try to keep the steri strips on them. It's important to note that you could have weakness in the corner of your smile. That is temporary. At most, it'll last maybe 6 to 8 weeks, but it will get better. What that looks like is one side might be a little bit weaker than the other side. Again, that's completely normal and will return to function, so don't freak out about that. In addition, after a week or 2, you might actually notice some firmness underneath your neck area. That is normal. You want to do a little massage, circular massage, twice a day under the area and the stiffness to soften that up. If you've had arm liposuction, make sure that you have your compression sleeves on. If they are cutting off circulation to your hands and your hands are getting swollen or you're getting numbness in your hands, take them off. No big deal, okay? The compression is there to help prevent swelling, but if you don't have it on, it's not going to hurt your result. If you've had thigh liposuction and you have the tet hose on, make sure that they are up as far as they can. You want to make sure that any compression garment you're wearing doesn't have a groove developing in any of the seams. If it does, loosen it up, and if it still does, then just take it off. So I want to talk to you about some products that you should be taking after your surgery. It's really important to help you heal and help manage your symptoms. The first one I love is CBD. Okay, I recommend this product, Wild Health CBD. You take a full dropper, put it underneath your tongue right when you get home, and a full dropper right before you go to bed. You can actually increase as needed. You will sleep like a baby, and it'll actually calm your anxiety and calm down your pain to a manageable level. Magnesium is a great supplement for 3 main reasons. First, it helps control the muscle spasms that you get can be experienced as pain after surgery. Second, it helps with constipation, helps keep you regular. And third, it helps you sleep at nighttime. The best way to take this is 2 of these capsules at nighttime right before you're about to go to bed. Arnica, this is a product we recommend. It has arnica and bromelain in it, so that helps the swelling go down naturally and it helps the bruising. What else do you need to take? Well, there's a product I also recommend. It's called Heal Fast. It's a vitamin supplementation that's designed to help you heal right after the surgery so that your body has the necessary nutrients to heal. You need to take 5 of these twice a day. I know that's a lot, but you need all of these nutrients to heal and to detox your body from the anesthesia. The other product is Masszymes that has a whole host of enzymes, digestive enzymes. You want to take 4 of these pills with every meal to help break down the food and help decrease your body's inflammation so that you heal faster. You can absorb the nutrients and it decreases inflammation in your body. This stuff has been proven to speed up your recovery. It is a must if you're going to have any surgery by me. Lastly, scar gel. Pick up the Scanuva scar gel. You want to use this on your incision twice a day. The reason why I like it's got silicone and a bunch of other fetal growth factors that help the incision heal. Plastic surgery is a stressful experience on your body, and oftentimes we prescribe antibiotics. That's why I recommend the Probiotic 225, which is a powerful, doctors-only probiotic that you can take to help restore your gut flora and fauna after your surgery and after any antibiotic use, okay? There's packets in here, you use one a day, you can mix it into cold water, you can take it with antibiotics at the same time, and you want to take one packet each day for at least 2 weeks, which is normally the amount of supply in each box. A lot of people ask me, when should I contact your office? Well, you're going to do great. For the majority of people, there's going to be normal swelling. But if you notice a few key things, I want you to give us a call. If you notice that one side is dramatically more swollen than the other side, that could be a sign of a hematoma or severe bleeding, okay, on the inside. If you get a severe body rash, if you get severe pain, especially if it's on one side, that could also be a sign of a hematoma. Normal body temperature varies from 97 to 99 degrees. If you get a temperature of 101 or more, I want you to give us a call, okay? That could be a problem. Significant drainage from your incision, we're not talking a little bit of bleeding, but if you're getting pus draining out from your incision, that's something we should also be made aware of. If you get redness that spreads around from your incision, that spreads out on one side or both sides, that could also be a sign of infection, and we need to know about that. If you're unable to keep any food down for more than 24 hours or any fluids, and you're feeling very dehydrated, you need to give us a call or you need to go to the emergency room. Also, if you have any significant bleeding or purulent drainage from any of your incisions, let us know. A little bit of bleeding is okay. A little bit of clear fluid is totally normal from a liposuction procedure. That's okay. But if you're getting a lot of bleeding or swelling in the abdomen area, that could be a sign of a hematoma. Now I'm talking like grapefruit-sized swelling. Okay, not talking about generalized swelling. That's it for Mommy Makeover. Follow all these instructions in this video. You're gonna do great, and call us if you have any questions. Make sure to tag us in your recovery journey, all right? Hashtag Barrett Recovery is the best way to share your experience so other people can learn from your journey.